Hi, everybody, and happy holidays to you and your families. This week we saw the first COVID-19 vaccines being given in the U.S., and this, of course, is fantastic news. And it's also an incredible logistical operation, unlike anything our country has seen in recent history. And you can be very proud that the FAA is at the forefront of enabling and supporting this vaccine rollout. So this week I want to highlight the agency's efforts to plan for and support the distribution of these vaccines across the country and even internationally. It starts with the COVID-19 Vaccine Air Transport Team, which began its work back in October. The team is comprised of people from multiple disciplines across the agency, working together to make sure that vaccines arrive here safely and quickly. Now, this isn't an abstract concept for us at the agency. We know it will save lives. The FAA is grieving the loss of several of our own from COVID-19. They came from all walks of life, from all parts of the country, and from all mission specialties, both federal employees and our contractor colleagues. The untimely passing of some of our coworkers leaves a big hole in our workforce and in our hearts, but it also serves as motivation for us. We honor their memories and their families through our critical work on vaccine distribution. And in the process, we're serving our country and our fellow citizens. As you know, the Pfizer vaccine has to be kept at extremely cold temperatures during transport. And this is no small feat. In accordance with their FAA-approved dangerous goods programs, airlines typically move perishable goods by packing the shipping containers with dry ice, but in nowhere near the amounts necessary to move a large payload of this particular vaccine at these temperatures across the nation and earlier this month across the Atlantic Ocean. Now, rather than trying to obtain waivers or modify the shipping equipment, which might have been the case years ago, and a time-consuming and expensive proposition, the airlines have been able to use their safety management system processes to put controls and mitigations in place to significantly increase the amount of dry ice they can safely carry on board these flights. This boosts the number of vaccine doses in the cargo hold and guarantees the safety of the crew. Now, just last week, the FAA issued a safety alert for operators, or SAFO, for safely transporting larger than typical quantities of dry ice to maintain cold temperatures required by some of these vaccines during shipment. The SAFO explains to the industry how increased volumes of dry ice, which is a hazardous material, can be safely managed. We're also working with manufacturers and airports to make sure that this precious cargo is moved safely and within the regulations. And last week, we provided planning considerations to the nation's airports to facilitate the safe and efficient transportation of COVID-19 vaccines. We stress that airports should consider their operating environment to ensure that they're fully prepared for aircraft that are carrying COVID-19 vaccines. This guidance applies to airports serving as destination hubs for the vaccine, but it also applies to those airports that might be alternate or diversion airports. For example, airports should have adequate aircraft rescue and firefighting coverage for these kinds of operations. They also need to have snow removal equipment and procedures to clear runways for aircraft that are transporting vaccines. And they need adequate aircraft parking areas available for vaccine transport aircraft. Airports should also ensure priority access to the airfield for freight vehicles. Now, this might mean preparing a staging area for freight vehicles that are awaiting their cargo to quickly and safely move shipments of COVID-19 vaccines off the airport. Airport operators should also work with their local air traffic control facilities before and during any vaccine transport flights movements on the airfield. And of course, we're making sure that our air traffic services are ready around the clock to support these flights. And we will prioritize those flights that are carrying vaccines. And speaking of air traffic controllers, it's important to note that the FAA Office of Aerospace Medicine determined that our FAA controllers who are subject, as you know, to FAA medical clearance may receive the Pfizer vaccine. We also determined that pilots can get the vaccine under the conditions of their FAA-approved Airman Medical Certification. However, to maintain the highest level of safety in the national airspace system, we will require a waiting period of 48 hours following the administration of this vaccine before these folks can conduct safety-sensitive aviation duties, such as flying or controlling air traffic. Now, because the Pfizer vaccine requires 2 doses, 21 days apart for maximum effectiveness, this waiting period applies after each dose. And when the time comes, I'm going to get a vaccine, and you should too. I encourage all FAA people to get COVID-19 vaccinations as authorized by the FDA and your doctor. Now, some FAA employees might be included in the initial groups of recipients of vaccines for essential workers. And this could vary from state to state or from city to city based on decisions by local officials who will be managing the distribution. The FAA is working with our labor organizations to ensure that employees who might be eligible to receive the vaccine are able to do so as soon as feasible, while also ensuring that we have the necessary staffing to maintain safe and available NAS services. We'll be providing additional details when they are available as we continue to work through this process. Now, while the vaccine rollout's a big step in overcoming this public health emergency, we need to continue protecting ourselves and each other by wearing a mask, social distancing, and consistent hand hygiene. We really need to stay vigilant. And if you're not feeling well for whatever reason, or if you develop any of the symptoms that the CDC identifies with COVID-19 or the flu, or awaiting test results due to a possible exposure to someone with COVID-19, please stay home. It's more important than ever that you take care of yourselves and each other, as we play a critical role in transporting and distributing the COVID-19 vaccines. And protecting ourselves and each other is the best holiday gift that we can give this particular year. 2020 has been a year unlike any other, but you continue to rise to challenge after challenge and find new ways to complete our mission 24/7, 365, never stopping. So with the holiday season upon us, I wanted to wish you and your families health and happiness. And while many of us will hopefully be able to take some well-deserved time off, many of our colleagues will continue faithfully on duty to keep the national airspace system safe and available, supporting travel and delivery of critical cargo. So, thanks everyone for your service and dedication to aviation safety. Again, happy holidays, all the best to you and your families, and I'll talk to you again in a few days.